Hello, my name is Brian. I'm a family nurse practitioner and student at Saginaw Valley State University. I'm going to be doing a brief respiratory assessment on you. Just looking at you right now, I don't see any signs of respiratory distress. So I'm going to do count your respiratory rate. So we're going to count for 30 seconds, and you just breathe normally. Alright, so your respiratory rate was 18, non-labored. Your rate is regular, with once again no signs of respiratory distress noted. Next I'm going to check for cyanosis. Your lips look fine. I'm going to check your nail beds. They're blue already, so I can't really tell. Next, I'm going to listen for audible wheezing, which I can't hear right now. And then I'm going to look for any signs of tracheal deviation, which I don't see any. It looks symmetrical. I'm going to check for accessory muscle usage, which once again don't see any. And then looking down here, I don't see any signs of retractions. So next we're going to inspect. Just looking at your thorax, I don't see any signs of asymmetry or deformity. Looking at AP compared to lateral diameters, AP is smaller than lateral, which is normal. And then I don't see any signs of asymmetry with your chest when you're breathing. Your chest wall looks as if it's moving appropriately. Next, I'm going to palpate. I'm going to palpate anteriorly and posteriorly, also looking for signs of bruising or lesion, which can indicate a broken rib. So you just let me know if you're feeling any pain or tenderness. Any pain or tenderness?
Nope.
Okay. Next, I'm going to check for chest expansion. So I'm going to have you turn that way. I'm going to check posteriorly first. I just want you to breathe in and out fully. Alright, perfect. Next I'm going to check anteriorly. Breathe in and out. Alright, hands moved apart evenly. No signs of any asymmetry with the chest wall. So next, I'm going to move on to tactile phrenius. So what I want you to do is just repeat 9999 until I say you can stop, okay?
999999999999999.
From the front, keep saying it.
999999999.
Alright. Vibrations are felt evenly on both sides, both anteriorly and posteriorly. Next I'm going to check percussion using the ladder method. So I'm just going to percuss posteriorly first. Anteriorly, using the same ladder method. Alright, Next I'm gonna check for your diaphragmatic movement. Alright, so what I want you to do is exhale completely and hold your breath. Alright, and then inhale as deeply as you can and hold it. Alright, there's 3 centimeters, which is normal. You want it between 3 and 5 centimeters. You're listening for the change in resonance. 2, dullness, which would indicate the level of the diaphragm, and then you're checking for the movement. But resonance was heard with percussion throughout all the lung fields, both anterior and posteriorly, with the exception of over the heart. There is a bit of dullness. Next, I'm going to auscultate your lung fields. I'm going to have you breathe in deeply, in and out of your mouth. Alright, and now anteriorly. Alright, so lung sounds were clear bilaterally. Inspiration throughout most of the lung fields is longer than expiration, which is normal. It had a low soft tone throughout the majority of the lung fields, which is normal. Next I'm gonna do the post-tussive test, which involves you coughing. I'm gonna take a listen to your lungs after you cough, so maybe a big cough. Alright, sounds normal. Next we're going to do a couple voice transmission tests. This would what you would do if you were concerned with any type of consolidation. So we're going to have you repeat the 9s again like you did before. I'm going to take a listen, okay? So just say 9 over and over again.
9, 9, 9, 9, 9, 9, 9, 9, 9,
Alright, there were no areas that sounded louder than the rest of the areas, and that would be a sign of bronchophony. Next, I'm going to have you say E, 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 E.
E, 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 E.
Alright, I didn't hear any times where the E sounded like an A, which would indicate potential consolidation. It's egophony is what we're checking for there. And then the last one is a whisper test here. So I'm gonna have you whisper 1, 2, 3 very quietly, and then just keep repeating it. Alright, and I didn't hear, when you were whispering, which is a normal result of that test. So I believe that is it. Thank you.